Hello, welcome to Advice in Action, the conference event for the Advice in Southampton Partnership. This session looks at the advice and support that's available for cancer patients. Our speakers today are Eva Richmond, a caseworker at Hampshire Macmillan Citizens Advice Service, and Jagdeep Gill, also a caseworker at the Maggie Centre Citizens Advice Service. Today, we're going to explore the types of problems that cancer patients often face on top of their diagnosis, and we'll look at how these local services can help, including applying for benefits, employment support, money advice, and dealing with housing issues. And finally, we'll look at how our services work and how you can signpost or refer to our services. I'm now going to hand you over to Jagdeep and Eva.
Receiving a cancer diagnosis is by itself distressing for a patient and their loved ones. Their diagnosis often goes hand in hand with a reduction in income and an increase in household costs, contributing to increased stress just when the patient needs to focus on their physical and mental health.
What issues do cancer patients face? So these can be things like reduced income, increased costs, complex benefit system, employment issues, and housing problems.
Cancer patients often need to stop work for a long period, leading to a reduction in income. And this is because most employers can only afford to pay the statutory requirement of statutory sick pay, which is about £96 a week.
There are increased costs associated with cancer, such as travelling for treatment, needing to put the heating on more at home, and perhaps having to pay for home help.
So the reduction in income and increased costs can lead to money worries and often to problematic debt.
The benefit system is complex and trying to navigate it can be overwhelming, even more so for someone struggling with a serious illness and effective treatment. Lots of benefits have different eligibility criteria and rules that are applied.
People can't always identify what they're eligible to claim, or they can be put off by the claiming process and that way missing out on valuable financial support.
The DWP sometimes gets it wrong. Clients can't always identify when this has happened or do not have the knowledge and resources to challenge a decision.
So how can we help? We offer free, confidential and impartial advice through the Macmillan Cancer Service and the Maggie's service at Citizens Advice Southampton. We do this by offering help with benefits. So we offer benefit checks, which help to identify eligibility. Often this is the most complex part of the benefit system for people to work out which benefits apply to their situation. We also can advise on the claims processes. There are various different ways that people can claim different benefits: online, by telephone, by filling in forms. Often it is quite complex to work out which is the most beneficial way to apply, and help can be given through guidance from our services. We can also help with the form filling or the application processes where people need this, and quite often people may need the additional help because of their serious health issues, and we can offer support if things go wrong. So the Department of Work and Pensions can make mistakes sometimes, and this can lead to impacting on the amount of money people receive, and we can help because we have a good understanding of the rules, which public may not.
We help to dispel some of the myths about claiming benefits which impact on people's perceptions and can stop them seeking help, including people with savings can't claim benefits, Homeowners can't claim benefits. Self-employed people can't claim benefits. Only slackers claim benefits. Everybody will know if I claim benefits. Some of these barriers are stopping people from getting the help they need.
We can also support with other issues. For instance, we assess for cancer-related grants, including Macmillan grants, and we submit applications. So the Macmillan grant is a small amount of money for people with a cancer diagnosis because Macmillan recognised the increased cost and the reduced income. So the grants can help with such things as paying for the cost of travelling to and from hospital, or that extra heating bill that you've incurred because you're spending more time at home, you're feeling the cold more, etc. We can also help with blue badge applications, and we can advise on employment issues because quite often people with serious illness and long-term illness can impact on people's job security and they're concerned about their employment rights. So we can advise people in that area. Also, people can start incurring debt due to their reduction in income, and we can give advice in that area. And housing can become an issue because people may find that their housing situation may be put in jeopardy because of the reduction in income, and or their current housing may not be suitable for their increased health needs. So we can support people with applying to move home. With these last three issues, if people need in-depth, more professional expertise, we can signpost them to other services within Citizens Advice or other qualified organisations.
Most patients with a terminal diagnosis are automatically eligible for certain non-means tested benefits and a blue badge. They may also be entitled to an increase in other benefits that they are eligible for. This applies where the prognosis is that the life expectancy is 6 months or less and a DS 1500 can be issued. The rules will be changing as of next year for life expectancy to 12 months or less. The DS 1500 is medical evidence needed to fast track benefits and a blue badge application. It can also be used as medical evidence for grants. It will help your patient if you send us a copy of the DS 1500 when you refer them to our services. The DS 1500 can only be issued by a registered doctor or nurse.
So how we work. The Hampshire Macmillan service is accessible to clients through a dedicated telephone advice line, by email or letter, face-to-face at home visits and ward visits at the hospital, and a drop-in centre at the Macmillan Information Centre on Level B at Southampton General Hospital.
The Maggie Centre can be accessed via telephone, via our drop-in service, which is Monday to Friday between 10 AM and 12 PM, or through a direct referral to our service. So a case study here at Maggie's. Recently we had a client who was pension aged who attended the Maggie Centre with his wife as he required help with a blue badge application form, which he didn't feel able to do himself. We supported the client to complete the form and also carried out a benefits check. The client wasn't eligible for means tested benefits, however, we identified that he would be eligible for attendance allowance. This is a disability benefit for pension-aged people that is non-means tested. We helped the client to complete the application form for attendance allowance and explain that we believed he would be eligible for the higher rate, which would be £60 per week. The extra money will help the couple to manage the additional cost incurred during his treatment. We explained that should the higher rate not be awarded, we could help the client to appeal the decision. The couple were both happy and grateful for the help that they had received.
Here is a case study about a cancer patient who accessed the Macmillan service. So his name is Dan and he is 31 years old. Dan works in his local garage, earning a moderate wage. He lives with his girlfriend Alice in rented accommodation. Dan visited his GP after experiencing some unusual health problems. His GP immediately referred him to Southampton General Hospital. After investigations, Dan was diagnosed with cancer. He had an excellent prognosis. However, he did need to have surgery and a course of chemotherapy, meaning that he'd be unable to work for about 6 months. Dan's employer was only able to pay statutory sick pay of £96 a week. Dan is quite distraught by this. He doesn't know how he can pay his rent and bills, let alone the cost of transport to hospital for treatment. Dan's nurse referred him to the Hampshire Macmillan Citizens Advice Service. The advisor completed a benefits check and advised Dan to apply for universal credit and council tax benefit. The advisor explained the application processes, which Dan said he could manage himself. The advisor also recommended that Dan contact his fuel and water companies to discuss social tariffs, and the advisor applied for a Macmillan grant towards the cost of transport to hospital. Dan said he felt far less distressed once his financial worries were alleviated and was glad to be able to concentrate on his treatment now.
So how you can help: by signposting patients or clients to us by giving them our contact details, explaining the types of services we can offer, directly referring patients to us either by phone, email, or via our online referral form, or forwarding a DS 1500 with a referral where relevant.
Thank you very much to Eva and Jagdeep, and on behalf of our speakers, thank you for listening in. If you have any questions or comments about this presentation, you can email them to conference@adviceinsouthampton.org.uk and we'll make sure they're forwarded to the right person. I'm going to leave you with the contact details of the 3 organisations that we've spoken about in this presentation. Thank you for listening.